السلام عليكم, صبحكم الله بالخير. Good morning. I am here from Bahrain Free Labor Union Federation in cooperation with the Solve Workers Youth Trade Union and AJ Medical Center. We usually provide awareness lecture about health. We see all around Bahrain, they are participating in medical health awareness in various occasions. We've got for women, for kids. Why not also enhance this campaign as a Movember to take care of the health of the men? Mostly men are complaining they are not taking care about us. No, in Bahrain Free Labor Union Federation, we saw that this is our first lecture for November. Inshallah, hopefully we will continue this kind of awareness amongst the year, this year and the next years as well. I would like to personally thank Mr. Yusuf Adil for his cooperation, and he is fighting really hard to provide this kind of lectures for you and to open your eyes for different occasions that the trade union has for you guys and for all the employees, whether you're a member or not. So I would really thank you as well for your support for him. Please be with him in all the occasions. Hopefully he will bring more benefits for you guys, just like these lectures or other different lectures during this year and the next year. I would like, well, let's all welcome Dr. Jallal Akbar to give us this lecture about cancer prostate, and please, whatever information you get from here, share it with your colleagues. And welcome, Dr. Jallal.
I don't know, Ms. Sarah spoke in English, so I don't know, they told me to talk in Arabic. So we'll try to mix little Arabic and little English as we go on. أولا مشكورين على استضافتكم لنا من مركز AJ للنقابة والموظفين الصلب. موضوع البروستات أو الأورام بشكل عام هي لاحظنا أن الأورام قاعدة تتزايد. So it's an increasing disease. It's no more like we used to say that it's a disease of elderly, old ages can get cancer. Now young generation, younger people are getting cancer. So it's always good to know about the cancer and how to prevent it and how to protect ourselves from the cancers. So as we said that October was a pink month. So we men, we felt jealous and we thought, why not a blue month? So we started to have a campaign. Actually, it's not new. It's been there in Europe and America since a very long time, raising fund for the cancer researchers. But in Bahrain, myself, I got involved with the Ministry of Health probably around 6-7 years. We started this Movember campaign and tried to reach the companies, the people on their premises, because not everybody will come to the hospital. They are busy, you are busy with your works, people are busy in shopping. So we used to go to the malls, we used to go to the factories to bring awareness to the men. So today we will be talking about prostate cancer. The aim of today's lecture is to discuss about prostate issues, prostate cancer, and we will see what are the risk factors and how it is diagnosed. Shall we go into Arabic or it's okay? It's okay. So I will try. If anything is not clear, we try to make it in Arabic as well. So we want to emphasize on screening about the awareness and screening of prostate cancer and early detection of prostate cancer. And we will also touch base on the other conditions which is involving the prostate cancer. And if we have time and you have the interest, we will talk a little bit about the sexual dysfunction, male sexual dysfunction. So talking about prostate, what is prostate? It's a male organ. غدة ذكورية موجودة في أسفل المثانة تمر فيها الحليل. So it's a walnut size, a small gland. It's very important for men. It produces enzymes. It produces nutrition for the sperm. جدا مهمة حق الإخصاب والإنجاب. العضلات اللي موجود فيها تساعد في عملية القذف، والمواد اللي موجودة تساعد في سيولة السائل المنوي على أساس الحيوانات المنوية تتحرك وتعمل الإخصاب. طبعا تكبر مع العمر. So as we grow older, because of the hormonal changes in the body, the size of the prostate may get bigger. Not necessarily every person gets a problem with this prostate size, but most of the time when it gets enlarged, it gives us some symptoms that we will discuss later on. Okay. So problems that happens with the prostate is prostate cancer, number one, that we want to be aware of and we want to know about it and how to prevent it and how to get screened and tested. And the other problems are like benign enlargement. Most of the men at age of 60, they get some symptoms, voiding or urinating symptoms, which is because of the enlargement of the size of the prostate. And the last one is the inflammation of the prostate, which is called the prostatitis. It's very common in the younger age group. We will come to the details about it. So, talking about prostate cancer, it's very common in men. Of course, prostate is there only in men, so female, they don't have a prostate, so it's a man disease, I would say. So it's the second most common disease in the men and the second most leading cause of death related to the urogenital cancers. About 1 out of 6, 1 out of 7 person can get prostate cancer. But the good thing is that the good thing is about 25% of these cases are clinically significant. There are 75%, the cancer may be there, but it's silent disease and it does not affect. That has another problem, that it's silent, so we don't know and we cannot discover it until sometime it's very late. As I said, it's a silent disease. So there is no warning signs. So that's why it's very important to have early screening, early detection. 21% of these cases are discovered after disease is spread outside the prostate. Okay, and if the key message is if we screen and we detect the prostate cancer early, so we can cure it or we can treat it almost 100%. Okay. These are some facts about Bahrain, about the cancers in Bahrain. So there are annually like 1,300 cancer, and there are around 600 deaths related to the cancer. And prostate cancer is, if you look, it's the third leading cause of death in men. I mean, death related to cancer in men, the prostate cancer is the third leading cause. So again, if you look the colorectal cancer if we are talking about men, of course, if we talk about global or general, the breast cancer is the most common. And if we talk about the female, it's the number one cancer in the female. But in men, colorectal cancer is the major one, and comes the prostate cancer, the second or third cancer in the men. And the mortality is very high, and as you see, so the prostate cancer mortality has that red lines that you see. So the cancer like lung cancer, colorectal cancer, and prostate cancer, the mortality or the death from the cancer is higher than the other condition. So what are the risk factors or what are the causes of prostate cancer? So as I said, it's a disease of elderly, disease of growing in age. So age is a definitive factor. So the mean age is 72, but the population can get it from 50 onwards. Also, a younger age, I had patients in 37 years of age, they got prostate cancer. It's not that common, but still it can happen. But if you look at the mean, the average is the elderly male. The other thing is our food habits, our eating habits. Now we are, because we are working, we are busy, we go for junk food, animal diets, animal fat, and junk diet. So these has hydrocarbons and other saturated fatty acids. So these could be a cause of cancers in general and prostate cancer. Family history. So it runs in the family. If a person has anyone of the family, for God's sake, the father or brothers or uncles, the first degree, so the chances of having prostate cancer increase up to 8 to 9% more than the none without any family history. The geographical area, it's more common in European and Western country. Alhamdulillah, it's less in Gulf region, but the trend that we have noticed that it's increasing. Probably it's because of the awareness, people are coming forward to get tested, and the availability of the investigations. So the numbers are increasing year by year. We see the numbers are jumping and going high up. It's also noticed that the dark-skinned people, the African, the incidence of prostate cancer is much more higher than the white-skinned or the Caucasians. And the incidence of prostate cancer increase with age. So there has been some studies done in, like in Italy, there was one study, they looked at the autopsies, the dead bodies. So at the age of 80 or 90% had prostate cancer, but they did not die because of prostate cancer, they died because of different reasons. So it means that as we grow older, there may be changes in our prostate cells, and cancer is possible to happen. So that's why we have to take care. And one thing we should remember, that benign enlargement of the prostate, of تضخم البروستات الحميد, it will never change to cancer. So وايد يسألوني إن حجم البروستات العام كان 30 صار 40، هل تحول لكانسر؟ لا. Cancer can happen in a small prostate, or it can happen in a big prostate, but the benign prostate or the تضخم الحميد will not change to cancer unless if there is cancer cells already there in the cells. Of course, genetic, as we said, overweight, our unhealthy diet, sexually transmitted diseases, lifestyle, our lifestyle, no exercises, nothing. You are lucky that you have such beautiful halls and exercising facilities, but yeah, the sedentary life is one of the causes of having different diseases, including the cancer. Symptoms, how the patient will come, or what do the patient feel if they have any disease of the prostate or prostate cancer. Mostly, prostate cancer is a silent disease, as we said. There is no symptoms. They come without any symptom. They just incidentally, they do routine tests. They found there are some prostate cancer. But otherwise, there can be urinary problems, interrupted urine, frequency of urination, nighttime urination, inability to urinate, blood in the urine. These symptoms that I'm saying, they are common in cancer and non-cancer enlargement of the prostate. So if someone has these symptoms, does not mean they have prostate cancer, but this is warning signs that you should go and check and make sure that there is a cancer or not. How we investigate? There are simple tests which used to be done, is the digital rectal examination. We have a model here also. We can show you how the doctor will feel the prostate. The feeling is, we can see some nodules, some changes in the tissues. And the other test is a simple blood test called prostate specific antigen. If it is high, it gives us a warning sign, so we need to do further investigation. If the doctor's investigation, clinical examination, digital rectal examination, or PSA is high, then we have to do further investigation, which includes an MRI, and then we take biopsies. We take sample from the prostate to make sure there is cancer or not. And once we detect all this, that there is suspicious of cancer, or actually we diagnose it with the staging, and we call it risk stratification. That depends on the age of the patient, the life expectancy of the patient, overall status of the patient, and the growth of the tumor. If it's a small tumor, localized tumor, or it's an advanced tumor, metastatic, we call it منتشر في الغدد الليمفاوية أو في العظام. So the treatment will be different. So the treatment basically is, if it's simple, it's just observation. We can just watch the patient and follow up. It depends also on the age expectancy, as we said. Someone is like 80 years old. I will not, do a large surgery or, عرضة للإشعاع أو chemotherapy على أساس his life will be more miserable than I'm benefiting him. So we'll keep all this into consideration, plus counseling with the patient, what patient wants. If the patient wants to go for a surgery, if he is within the category of surgery, we will offer him surgery. If he is not the category of surgery, then we can offer him radiation or hormonal therapy. So there are multi-modal therapies for the prostate cancer. It depends on these parameters. So as we said, if it's a localized cancer, then we can do just active surveillance, we can do surgery, we can do radiotherapy. If it is metastatic, then no role of surgery, we can do chemotherapy and hormonal radiation therapy. Okay? But as I said, the good news is if we detect, if you go and do check, and for God's sake, you have some doubt, then it can be treated almost completely. Can we prevent it? Is there a way we can prevent the prostate cancer? We look at the risk factor. Age, I cannot control my age. My genetics, I cannot change them now. Family history, I cannot change it. If I'm born in Africa or here, I cannot change it. But there are other parameters which are in my hand, in my control. My diet, I do exercise, I quit smoking, I take healthy food. So these are protective measures which will reduce the chances or incidences of having prostate cancer. But as such, if is there a medicine? No. You will see a lot of studies, they will say take this, take that. Yes, sometimes some of these studies will show you some benefit, but none of them are statistically significant. So basically there is nothing as such as medication till now. There are studies being done on the vaccinations, but we hope that will come in near future, inshallah. Okay? So that's basically a brief about prostate cancer. We'll move to the other conditions of prostate. As we said, benign enlargement, تضخم حميد. It's most common in the aging group also. The mean age is above 50 or 60, and it's a benign enlargement, it's not a cancer. It does not increase the risk of prostate cancer. Same symptoms. That's what I said, that if you have difficulty in passing urine, interrupted urine, waking up at night to pass urine, and there is a myth also. If all the patient comes, I said, I wake up 3 times at night, but yes, I have diabetes, I have sukkar, so it's normal. That's not always normal. That's not always because of diabetes. So prostate is the bigger element of making you wake up at night. Okay? There are other causes like infection, urinary infection, prostatitis, but you should not always leave it that because I have diabetes, it's okay, I wake up 3 times, 4 times at night. So you should go and get checked. The treatment of benign prostate hyperplasia is basically medical treatment. We give single medication or combination of medication that will control, improve your urinary flow and control your symptoms. Or we have surgical options. There are a lot of surgical options, standard, something called the transurethral resection, تنظيف البروستات, تقشيط البروستات, أو laser vaporization, laser inoculation. There are some new technologies, holmium inoculation, Urolift and Rhizome water vapor therapy. So basically, if we go back to this one, this is, so this is a Rhizome water vaporization. We inject some vapor in the prostate tissue, and it will eventually help to shrink the size of the prostate. these new technologies are made to reduce the risk or the side effects of something called the retrograde ejaculation, the dry ejaculation. So we go for these new technologies. So these are some cases that we are doing in different hospitals. There are different type of laser, something called slim light or speedia. There is also another laser called the green light or the KTP laser. It's a bit faster than the Expedia, but the idea is the same, to open a space or open a channel in the prostate and the prostatic tissues. This is also something new. It's still not available in Bahrain. It's not new. It's been there for almost like 10 years, but it's still not there in Bahrain. I'm not sure Kuwait, they said they brought one, but still they don't have much of the cases. So the idea is same, the prostate is enlarged. So the prostate is big and it's blocking the urinary channel, المجرى البول. So after putting these clips, you open the prostate wide. The thing is, you have all these different techniques. Aquablation. Aquablation is also a new technique. It's been invented in USA. It's just with water vapor, like a brush. It will morcellate or cut the tissues, or prostate tissue, and make the channel open. There are different modalities. I mean, one treatment does not fit all. So you should discuss with your doctor what treatment is best for you. Sometimes, like if I said that urolift, but urolift is not good for a big prostate, like a 100-gram prostate, it will not be helpful. So it's useless to do that. And same thing, aquablation, for example, for a bigger prostate, though they claim now they reach to 150-gram prostate. See, this all prostate tissue is gone. Now these are the water and coming out. Okay. Inflammation of the prostate, prostatitis. It's basically bacterial or non-bacterial. It's mostly happened with in sexually active age group population, younger population, and it's bacterial, as I said, because of sexually transmitted diseases, and sometimes because of the fluids in the prostate get inflamed, so it's non-bacterial prostatitis. So if it is treated early, it occurs as acute, sudden, but if not treated properly, then it will be chronic. It will come again and again. The symptoms, it's almost the same, except that they can have fever, chills, and pain in the perineal area. Okay. The treatment basically is to treat the infection. If there is infection, so we treat the infection with antibiotic, strong antibiotic, and it requires long-term antibiotic. Sometimes we use the antibiotic for a month or a month and a half. Then we treat the symptoms. Patient will have frequency, burning sensation, so we treat those symptoms. And pain, they will have the pain, so we have to treat the pain. It is bothering disease. It's written in our books. It's bothering for the patient and for the doctors, because patient will have always the pain, and patient will always come to the doctor nagging that I'm not okay, nothing is happening to me. So it's a disturbing disease, so it needs psychological symptom treatment, either counseling or even sometimes some medication. Okay, so last is because we're talking about men's health, about the sexual dysfunction, just briefly about it. So sexual dysfunction means if a man cannot attain or maintain an erection to perform a sexual activity, it's called sexual dysfunction or erectile dysfunction. It can happen sometime suddenly, temporarily, and it will go. It happens sometimes that you are normal, you get married, and because of psychological reason you cannot perform, but that's temporary and it's gone. But if it is persistent and ongoing, then there is an issue. We have to go and find the reason and treat it. Why I brought this topic also, that prostatitis, prostate cancer, and sometimes the benign enlargement of the prostate, that also can lead to sexual dysfunction or erectile dysfunction. So that's why it's important also to have a brief about it. There are psychological causes like anxiety of performance, stress, fatigue, depression, change in the relationship, man and wife are fighting with each other, so they definitely they will not be in good status of having erection or sexual function. Age is not a cause, but with age there are different diseases. They can get diabetes, hypertension, prostate issues, so that can also lead to problem. So just to summarize, that it can be because of a lot of factors: stress, anxiety, depression, obesity, smoking, lack of exercises, alcohol abuse, or medical diseases like diabetes, blood pressure, or ischemic heart disease, vascular diseases. So these all will cause some effect on the sexual function. With the psychological, basically the thing is it affects the hormone. So the effect of the hormone will reduce the sexual desire and sexual function, and the medical conditions will affect the blood vessel, the blood flow, so that's why erectile dysfunction can happen. The treatment is it's multifactorial. We start with the general measures, counseling, and patient, if he is a smoker, to quit smoking, exercise, have healthy food, so these can help. If not, then there are sometimes, if it's a psychological, so psychosexual therapy is important, and medications. Now everybody is aware of PDE5 inhibitor, Viagra, Cialis, so these medication can be given, but always make sure that you first time when you take it, you can consult your doctor, because there are a lot of side effects, contraindications, so you have to be aware of these medication. There are different devices, and lastly, if it doesn't, all these fails, there is surgical treatment, mainly the penile implants. So penile implant is different types. There is semi-rigid, rigid rods, or two-piece implants, three-piece implants. So it depends also on what is the need and what's the best for the patient. So that's why we discuss always the malleable or the semi-rigid with the hydraulic implants. So in summary, we would say the prostate cancer is a very common disease. It's second most common disease in men, and the death related to the prostate cancer is very high. So we always encourage the people to go and do screening and early detection. Screening means to do tests in normal people. So don't think that I am normal, why should I do test? It is because we want to detect something maybe hidden there. So once it is detected, and prostate cancer, it can be cured 100%. And that's why we said for the men, khallak shanab, go and get tested for the PSA. Simple test. So by that, you can save yourself, you can convey these messages to your loved ones, so they can go and do these tests. Thank you very much.